Well, good morning, everyone. I'm so glad to see you all here this morning on a beautiful October day in Washington, D.C. This annual meeting is an opportunity for us to learn, to share, to participate, and to build on the relationships with your colleagues here at the Institute of Medicine. I appreciate the background that Dr. Zhao has just provided you on the ambitious goals that we have for the Feinberg Impact Fund. And as you've heard, and you no doubt experience in your professions as well, the IOM has financial needs that are being amplified by the current federal spending policies. And we must recognize that our mission mandates us to serve the nation on matters of health, regardless of federal fiscal health. So in preparing my comments for you today, I thought I'd share with you a little background on philanthropic giving. This past year, Americans gave over $316 billion to charitable organizations. The aim has always been to make the country and or the world a better place. But there's often concerns that their giving is not making a real difference. And there was a survey that was conducted a few years back by the Hope Consulting Group where 4,000 affluent individuals were asked to examine the motivations they had for giving, the behaviors they exhibited when giving, and the degree to which they research charities before they give. Donors care most about impact. They want to know that their money is going to organizations that are offering positive change in the world. They are seeking information. They want to know about the financial health of the organization and how the organization spends its money. They want to know that the nonprofit is a legitimate 501c3. They want to know about the mission, how the organization approaches accomplishing these goals, and also they want to know about the leadership. Of course, more importantly, they're interested in the breadth and the depth of the cause that the organization is working towards. And finally, they really want to know that the nonprofit is actually making an impact. Donors care about nonprofit performance, and they want a clear picture of the organization. They want this picture presented in an easy-to-understand way. So this prompts me to share the following details of the Feinberg Impact Fund with you. We established a development committee of IOM council members who are assisting in the guidance and the development of this fund. We've been defining the fund by asking the following questions. How will this fund be used? What are the activities associated with this fund? How much does it cost to fund these activities? And how do we reach out to our constituents? And finally, what can membership do to participate? Now, Dr. Zhao has described to you the uses of the fund, the activities, and that's the new initiatives, the communication pieces, and the partnering and collaborations with others. But I thought it'd be useful for you to see what the costs are that are associated with these activities. There are ranges of costs that are dependent on the depth, length, and scope of an activity. But as you can see, and many of you may not have realized these prices that are associated with the work of the IOM, but a consensus study can cost between $1 and $2 million. Workshops between $300,000 and $500,000. Expert meetings, planning meetings have a range also of similar amounts of money. And we also have these communication pieces. These products range from as little as $5,000 and can be up to $50,000 and above, depending again on the type and the number of services that you wish to employ. We will not only reach out to you, we will also seek support from health industry professionals, corporations, and foundations. We will utilize our connections with these same sectors to reach out to high net worth individuals with known interests in health care, and are philanthropically inclined. In addition, your relationships with these sectors are extremely valuable to us, and we will seek appropriate introductions from you. We have prepared materials that will go along with this Impact Fund. Outside of the auditorium are some brochures on the Impact Fund for you to pick up on your way out. We also have that video that you observed of Dr. Feinberg. And we also have updated and refreshed our IOM website, so more information is available online, with also easier abilities to make your gifts online. We will be holding events in geographic areas that will bring prospective donors to small gatherings so that they can meet the IOM leadership. You are asked to participate by showing your support with a gift to this fund. As Dr. Zhao pointed out, we'll have 100% participation from our council because they believe they can only ask you to participate if they demonstrate their commitment as well. We are coming to you, the members, before we have secured more outside support because you are part of our effort. You are asked to give so that when prospective donors ask about our membership support, and they do ask, we can state that our members believe that this is the right direction for the IOM. Additionally, we believe that your spreading the word is equally important. Your understanding of the IOM's mission for the future is fundamental to the success of this fund. You are the ambassadors for the Institute of Medicine, and your support speaks volumes. And we'd like to recognize and celebrate our donors. Outside of this auditorium, on the wall, you may note that there is a donor wall. And on this wall are names of friends and members of the Academies who've made gifts of significant value. We have an IOM society where your cumulative giving of $20,000 or more will get you a name on the wall, or you can reach for the Einstein level with gifts of $100,000 or more. We invite you to become a name on our donor wall. Finally, we must note that the fund is named the Harvey Feinberg Impact Fund. And I would tell you, this was the first big challenge that I had with my boss. But from his first day, he has been asking what impact are the recommendations of the IOM having on health. We work so diligently. We have the best. We have experts standing behind our work. The findings should be available to improve health. What can be done to improve this impact? And we believe that this fund reflects the vision that Dr. Feinberg has held throughout his presidency. Naming the Feinberg Impact Fund is the IOM's recognition of the exemplary leadership and visionary strategy for the future of the Institute of Medicine. Dr. Feinberg accepts this humbly and because we insisted. But it is for the next president these funds will really be available to be put to use, and that he was okay with. So thank you so much for your time, and thank you very much for your support to the Feinberg Impact Fund.